Hello, everyone, and welcome to Beyond the Hospital podcast. I remain your host, Dr. Wahid Awonuga, and today is a special day. It is World Tuberculosis Day, a day where the whole world stops to talk about one of the oldest yet deadliest diseases known to man, tuberculosis, or simply TB. Now, I know when people hear TB, it sounds scary. I will be breaking it down for you today so you understand what it is, how to protect yourself, how to manage it, and most importantly, how it can be treated and cured. So let's jump right in. What exactly is tuberculosis? Imagine this. TB is like one very sneaky tiny germ, usually caused by a bacteria called Mycobacterium tuberculosis. Don't worry about that big name. This germ usually settles in the lungs, but here is the issue. It doesn't stop there. It can move and affect other parts of the body too, like your spine, your brain, or your kidneys. But 90% of the time, it's in the lungs. It spreads through the hair. So if someone who has TB coughs, sneezes, or even talks loudly, those germs float around like invisible dust, and anyone nearby can breathe them in. Simple, right? Now, not everyone who breathes in TB germs will fall sick. Let me give you an example. Think of your immune system like the soldiers protecting your house. If your soldiers are strong and well fed, they can fight off the invaders easily. But if you're already weak, stressed, sick, or malnourished, the soldiers are tired, then TB has a better chance of winning. Here are some groups of people that are at higher risk of having TB. People living with HIV/AIDS, people with poor nutrition or low body weight, people who smoke or drink heavily, people living in overcrowded conditions like slums or refugee camps. You also have the healthcare workers because we are exposed to many patients. And those who have had TB before are also at risk. Now, how do you know that you have TB? The classic signs include a cough lasting more than 2 weeks, coughing off blood, that is scary but true, chest pain, fever, especially at night, sweating at night, losing weight without you trying, that's unexplained weight loss and unintentional weight loss, feeling weak and tired. But sometimes the symptoms are silent, which is why testing is key. How do we test for TB? Let me break this down for you. We can do what we call the sputum test. We ask you to cough up some mucus or sputum from deep inside your chest, and then we check it under a microscope to see if the TB bacteria are there. It is quick, simple, and often free in many African countries. You also have the gene expert. This test looks at the genetic material of TB bacteria. It's faster and can even tell us if the bacteria are resistant to certain drugs. It's a game changer, especially in places like Africa, where drug-resistant TB is becoming more common. We also can do a chest x-ray. If you're not coughing up anything, a chest x-ray helps us look for those classic TB signs in your lungs. We can also do blood tests or skin tests. Sometimes, especially for children or people with TB outside the lungs, we may need more tests. And also for people that want to travel or for some occupational tests, you can also do the skin test. Now, how is TB treated? Now, here is the part everyone wants to know. Can TB be cured? The answer is a big, loud, reassuring yes. TB can be cured, but, and it's a big but, you must take the medicine properly. The treatment is a 6-month drug regimen. Let me simplify that for you. The first 2 months, which is known as the intensive phase, you take 4 drugs daily. This is to attack the bacteria aggressively and reduce the spread. The next 4 months, which is the continuation phase, you continue with 2 drugs. Now, here is the tricky part. After the first few weeks, you start to feel better. Your cough stops, you gain weight, and you might think, I'm fine now. Let me stop these drugs. Please don't. Stopping early gives the TB bacteria a chance to come back, stronger and even more dangerous. And when it comes back, it might not respond to the usual drugs. That is called drug-resistant TB, which is much harder and more expensive to treat, and it's a big headache for practitioners. Now, how is TB managed in Africa? In Africa, especially in countries like Sierra Leone, Nigeria, Kenya, and South Africa, TB is a big challenge, but we have made giant strides. There are free TB testing and treatment centers which exist in many public hospitals. There are also community health workers who go to do door-to-door outreaches, educating people. In some countries, they use mobile clinics for hard-to-reach communities. Then, you also have the integration with HIV programs because of the close link between TB and HIV. But still, stigma, misinformation, and lack of access make things tough. Why is it important to take the drugs exactly as prescribed? Think of it like this. You're baking a cake. If you pull it out of the oven too early, it won't be done. It will collapse. Same with TB treatment. Stop early and the disease collapses, but into something much more worse and harder to treat. You can imagine it in this way. For drugs that are being provided free and one decides not to take it, it becomes much more economic burden on the government. That means the money that has been used in treating has been wasted. Then you now give the government or the practitioner much more work to do with drug-resistant TB. Do you know that 1 in 4 people in the world have TB bacteria in their bodies right now? But they don't even know it. This is called latent TB. It is sleeping, waiting, but if your immune system weakens, it can wake up and cause disease. That is why healthy living, proper nutrition, and regular health checks are so important, especially if you've been in contact with someone who has TB. So on this World TB Day, I want you to remember TB is preventable, treatable, and curable. Testing is simple and often free. If you're diagnosed, take your medications exactly as prescribed, all 6 months. Spread knowledge and not fear. Let's break the stigma, support one another, and protect our communities, because health goes beyond the hospital. That is it for today's episode. Thank you for joining me. I am Dr. Waheed Awonuga on Beyond the Hospital podcast. If you found this helpful, share it with friends, family, neighbors. You might just save a life today. Till next time, stay safe, stay informed, and remember, you are more than just a diagnosis. Thank you.